are your pain meds secretly causing your blood pressure to go up? Millions of people rely on common pain relievers like ibuprofen, aspirin, and the rest. But these medications could be putting your heart at risk.
So let's talk about the medications that raise blood pressure. Right?
Okay. All right. So let's go from there. Some of the medications that raise blood pressure. We picked a group of medications. For the sake of time, we're going to stick to one group called the NSAIDs.
So the NSAIDs is just an acronym, right?
Yeah.
It's NSAIDs, which stand for non-steroidal anti-inflammatory drugs.
Okay.
So let's go over these drugs. Right?
All right. So the first one, which is very common, common over the world. Generic name is called ibuprofen or ibuprofen. In some places, they call it brufen. They have several names for it, but if you look at the ingredient and it says ibuprofen, that's what we're talking about. In the US, we have two brand names too.
We have the Advil and Motrin.
We have Advil and Motrin. Yeah. All right.
So if you are taking medication, so as we go over the list, we want you to pay attention so that in case you are taking any of these medications, you have to bring it up to your doctor, especially if you have high blood pressure. So we've mentioned ibuprofen, which is other trade name is Advil or Motrin.
Yes.
In other places, they call it brufen.
And then there's also aspirin. Actually, aspirin is the first NSAID, the first on the list. From aspirin, they developed all the rest. So aspirin, and in the US, we call it Bayer aspirin or, Bufferin. And I'm pretty sure aspirin is a common name throughout the world. But if you have a different name for it in your place where you are watching us from, then just take note that aspirin could also be doing some of the dangers that we're going to talk about. So the two here are the first two on the list of NSAIDs that we are talking about.
Yeah, as pharmacists, I think the aspirin, sometimes they take it off the list, sometimes they add it on. But like you said, it's the first one that they developed all the others. We also have naproxen, right, which is other trade name. We have the Aleve. Some places, they have naproxen. So however you pronounce it, just try and know the active ingredient, the generic name, which is naproxen.
Yes.
Yeah.
All right. And the next one is diclofenac.
Right.
Diclofenac also under another trade name called Voltaren or Cataflam. Diclofenac comes also in gels. So you may see Voltaren gel on the shelf is the same drug, but in particular, what causes the damage, as we will know later, is the tablet
That you take
prescription.
Oral. Okay. Yeah. And we have the indomethacin.
Indomethacin, which is the one that caused the harm in my grandmother's situation.
Indocin.
Yes.
Indocin.
Yes.
But you were saying Indocet.
Yeah, they also call it Indocet.
Okay.
My grandmother called it Indocet from where we were living here.
Well, maybe she was trying to say Indocin.
Yeah, I think there's a trade name in a different country called Indocet too. Okay. I could be wrong, but yeah, Indocin is a one that we know, that the brand name called Indocin, and it's also known as Indomedicine. And the next one?
Celecoxib, which is also known as Celebrex.
Celebrex.
Yeah.
Celebrex. And there's another one that was close to Celebrex, which was discontinued, called Vioxx. But we'll talk about it, why it was discontinued. And then there's more. We
have the meloxicam, which is also the Mobic.
Meloxicam or Mobic. And then we have Ketorolac, also under a brand name called Toradol.
We also have a Todolac or Lodine.
Lodine. Right? And then this one, I think, is also discontinued, called Piroxicam, at least in the US. If you're watching this from the UK or Europe somewhere, or even Japan, you may still have it under a different name. But in the US, I don't see it anymore. It was called Piroxicam or Feldine. And that
we also have Solidac.
Solidac.
Okay. And it's also called Clinorel.
Clinorel. That is also fading out. I don't see them use it as much, but that's another NSAID. And then the next one is Oxaprozin or Daypro.
Daypro.
I like the Daypro name. Come on, it sounds so good. It's not Nipro, so it's not. It sounds like it's not going to do you harm, but Dapro, it could be bad.
And we also have phenoprofen, which is also known as Norfon.
Norfon. And then we have ketoprofen.
Ketoprofen.
Ketoprofen is also called Uridis or Urivel. I don't see that also as much. I think it's present in some eye drops or eye formulations for pain and inflammation. But for oral or for taken by mouth, I don't see it. At least not in the U.S. And then
we also have the flurbiprofen.
And that I think that may also
discontinued.
That may have been discontinued. I don't see it anymore. In the maybe within some years ago, I used to see it a lot, but I don't see it anymore. And then there's another one called nebumetone. This is also commonly used in the U.S. Nebumetone, also under a brand name called Ralofen. Again, it may be under a different name from where you're reading, calling us from, watching us from. Just make sure that if you take pain medication, look at the active ingredient or the generic name, and you would see.
You also have diflunisal.
Also called Dolobed.
Right?
And this next one I haven't seen ever in my practice. So hopefully it is discontinued or maybe used in a different setting. It's called Telmetane or Telectane. And then
we have the Meclomen.
Meclomen, or in the generic name is meclofenamate. Yeah, the Meclomen, I haven't seen it either.
Yeah.
I haven't seen that. That's probably also being faded out unless it's used in certain specific settings. And then the last one is what we call salsalate or disalcid. I like that name too. Come on, man. Disalcid.
You're dying with acid.
Yes, we're dying with acid, right? And that's what it does too. One of the things it does. All right, let's move forward. So at this point, we're going to be talking about some of the common side effects. We gave you all the list, comprehensive list, some of which have been discontinued. There could be more that we don't have on this market, but it may be available in a different market. And so it may not be all that there is to it. And the other thing is, in some places, they may have, changed the name a little bit just to make it work differently, but it will still be an NSAID. So if you are not sure, your pharmacist or your doctor, is this an NSAID? Or is it one of those that can cause an ulcer or high blood pressure or those things? All right. So, yes.
Yes, so although these NSAIDs or these pain medications are very effective in treating joint pain, inflammation, fever, they come with various potential side effects.
That's the only thing. My goodness. I wish they did not.
We keep saying that everything that you take, any medication, comes with side effects. So this one is huge when you are taking something for inflammation, when you are taking something for joint pain. There's so many things that you have to pay attention in order to take it right.